The prelude. A couple things to take away. Focus on the word anxiety. Yes, this aromatherapy combination of two very common essential oils, in this case peppermint and lavender, yielded, when used appropriately, up to a 50% reduction in opioid use. The other thing to take away from this was a randomized placebo-controlled study, a very rigid study done by top-notch hospitals and your universities. Now keep in mind, top-notch is going to come back again as we go delve into the research, and you'll see why in a second. But here we have two very common essential oils, peppermint, lavender, reducing anxiety, which the hypothesis is that by reducing anxiety, it leads to the need for less of this powerful pain medication, i.e. opiates. And that is just incredible. And on top of that, the utilization of this intervention is so eloquent and simple that every hospital can be doing it tomorrow if they so choose. But with that in mind, let us proceed in the research as follows. Knowing the opiate situation as it is, this type of research is just have incredible importance in the dynamics of today's society. But to proceed as follows. Aromatherapy can reduce post-surgical opiate use by half, preliminary U.S. study finds. Aromatherapy reduces post-surgical opiate use by half in hip replacement patients anxious before their operation. Again, that operative word, anxious. According to a new preliminary study being presented at the annual meeting of European Society of Anaesthesiology and Intensive Care this June 4th through 6th. The study professor, hopefully I'm pronouncing this correctly, Jacques Chaly, and colleagues at the Department of Anesthesiology, University of Pittsburgh, USA, was one of the first to employ a randomized, placebo-controlled design to look at whether aromatherapy reduces anxiety. Participants are, or I should say were, randomized to an active treatment group, aromatherapy, or placebo group. Those in the active treatment group were given a lavender and peppermint aromatab. Aromatab is a particular item produced by a company. No promotion of any particular company here per se, but in order to understand the methodology and what was utilized, it's important because the company Eloquil produced this patch, which utilizes top-notch essential oils, which gave it its 8-hour duration of lasting in reference to this peppermint and lavender. And they also produce essential oils for clinical trials. Important to highlight because it's part of the study. To proceed. This active ingredient given to lavender, peppermint, aromatab, an adhesive patch that slowly releases essential oils when stuck onto clothes, skin, or a hospital gown. In this case, an hour before surgery, you know what, you get the picture. To wear from at least an hour before their operation. Patches are then changed every 12 hours and worn for 72 hours after surgery. That's incredible. Because you think about the impact this has. You're talking just by wearing a patch that slowly releases these essential oils, peppermint and lavender, just for about 72 plus surgery, or whatever it is, 73, 74, 75, 76 hours, just for that length of time. The profound impact that could have on an individual's life, it reduces the need for opiate painkillers. Do you imagine that? So if someone goes in for surgery or whatever it is, and just by this simple intervention, inexpensive intervention of peppermint and lavender, an hour before surgery and then 72 hours afterwards, can reduce the need for opiates by 50%. You realize the impact that has on society as a whole is just incredible. Now, all keep in mind too, albeit, you're going to think about, well, what about peppermint and lavender, just for reduction of anxiety as a whole? Well, this is kind of a testament to that in reference to the research here. To proceed, the research conclude, our results suggest by controlling anxiety, aromatherapy can help control pain and reduce opiate consumption. This is important given the established role of the use of opiates in surgical patients and the overall opiate crisis in the U.S. And you see I highlighted down below because I don't want to dwell on it. They assume potentially 1.2 million more people may perish by 2029 of opioid-related disorders. Let's hope not. Let's hope research like this surfaces and this intervention is easily utilized in many hospitals, provided other studies back per se. Hopefully, well, even if it doesn't, it's peppermint and lavender. Probably pretty, I don't want to say ad-publisher bias, but most likely not so reactive with other medications. Maybe, maybe not. That's something for future studies to employ. All right. Aromatherapy is a simple and cost-effective technique. Knowing how much things cost in the hospital, cost-effective is an understatement, which can minimize the impact of anxiety on post-operative pain and opioid consumption. And what about anxiety at the office, anxiety at school, so on and so forth? Quote, "We hope that providing objective evidence about the benefits of aromatherapy will help address the concerns of those who are skeptical about its value. Henceforth, the need for this rigorous trial to proceed." They say, at Presbyterian Shadyside Hospital, quote, "We are routinely using lavender peppermint aromatherapy in patients who indicate they're anxious before surgery." I don't know what the legal ramifications are or the bureaucracy involved or the red tape, but with results like this, what do other hospitals really have to lose except gaining the benefit? If worse comes to worse, it doesn't work, big deal. If it does, think of the impact and the positive benefit it has on society as a whole. Just a little bit of peppermint and lavender can do just a tremendous amount of good, if you're talking about truly doing good. To proceed, one possible mechanism, the postulating, of aromatherapy is through the limbic system, a brain structure known to regulate pain, emotion, and anxiety, according to the professor. And they plan to study the effects of aromatherapy on the brain next. Now, also, many of us know we've covered other research before where there's olfactory glands, or olfactory receptors, I should say, not glands, in many cells of the body. So you never know. By adding bias where you're saying it's a limbic system, it may be perfectly, it may be correct. But again, knowing how there's olfactory receptors in many different cells of the body we never imagined, you never know. It could lead to a totally new discovery in basically how aromatherapy may help benefit an individual beyond that just of smell itself. Again, you really got to give these researchers a ton of credit. Think about this. You're talking a very, very, very inexpensive, simple intervention. So easy to incorporate anywhere. And they can yield such an incredible beneficial outcome for many, many individuals that can last many, many years beyond even the intervention of 72, 73, 74, 75, 76 hours itself. Again, gratitude. That's the kind of stuff I like to see. And I am humbled that you watch, and I'll see you all next time. Catch you there. Bye.